According to the gender burden of disease, do you know that in 2017, about 585,000 persons actually died from the abuse of drugs? My name is Eigiato Samudame Ketsintin, and you are welcome to another fascinating episode of Healthy You, brought to you by RORL Food and Farm Consult. Of course, I'm not in the studio alone. I'm with the amazing doctor, a pharmacist, in the person of Mr. Onose Ihenye. He is also the managing director of Majenka Nigeria Limited, also known as Pures Wool. Welcome, doctor. Welcome to the show.
Yeah, thank you. It's a pleasure to be here.
Thank you very much. So, before we delve into the topic of today, which borders around the risk involved in abusing drugs, in abusing prescribed drugs, I just want to quickly look at something, because also for me, I'm not too conversant with the medical sector, even though I know like 18 or 2, but I'm not too conversant with what is going on there. So, doctor, I would like to know, or rather, pharmacist, I would like to know, what are there any difference between a doctor and a pharmacist, and who is saddled with the responsibility of actually prescribing and dispensing drugs?
All right, thank you very much.
Thank you.
If I must say, doctor is this question you've asked is a very common question, and it's something a lot of people misunderstand.
Very.
You know, a doctor is a specialist, is a professional, and so I wouldn't want to restrict it to just medicine alone. And so any professional is when I mean professional now, I mean someone that has specialized in a particular field, qualifies as a doctor.
Okay. So
it's not restricted to medicine alone. I'm a pharmacist and I'm a doctor, because by my specialty, by my how do I put it now? By my degree, I am qualified as a doctor. So you also have, and that is I'm a pharmacist. You understand, by profession. Yeah, but I'm a doctor by my degree.
all right.
And so just as you have for pharmacists, that's how you also have for other professions or professionals too. You have the optometrists. Optometrists now are also doctors.
Wow.
You have
General.
Yes, you have veterinarians. They are also doctors. You know, so that's just how it goes. Then a pharmacist, on the other hand, is a pharmacist as a professional. Is a drug custodian. What that means is he is responsible for drugs as a whole, from the manufacturing process to the delivery of the drugs to the patient. So it spans the span is broad. It's a broad specialty, as it were, and involves a whole lot, from the manufacturing to the dispensing of the drugs. And then even now, what we focus on now currently is pharmaceutical care, which means taking care of patients.
Wow, interesting. So, who is actually, because it's not a topic that is really talked about here in Nigeria, because I have a friend over there in Canada. I think there was a day I was chatting with him. I was like, he has an headache. I was like, why don't you just go to the pharmacist and get drugs? He was like, no, it doesn't work that way here. I need to go to a doctor, go for diagnosis, get a written note from an approved doctor, and come back to the pharmacist to get drugs. So, who is actually saddled with the responsibility of prescribing and dispensing drugs between a doctor and a pharmacist?
Okay, very well said. Very good question. Let me just add, before I answer that question, let me go. I differentiated a doctor from a pharmacist. Now, I guess you are talking about the physician. Okay. So a physician is one who is licensed to practice medicine. Okay. Now, in the healthcare system in Nigeria, the physician in the hospital setting is responsible for drug prescription. So the physician, it is the physician's duty to prescribe the medications, and then when the medication is prescribed, the patient comes to the pharmacist. Then the pharmacist, I don't want to use the word vet, but the pharmacist goes through the prescription and checks it. That's where pharmaceutical care actually kicks in. Immediately the pharmacist gets the prescription, and so he looks at the prescription, he checks for any, we call it drug therapy problems. We have actual and potential drug therapy problems. So if there are any problems, drug therapy problems with the prescription, the doctor is notified. And you know, it's supposed to be a collaborative process, and where the doctor, the physician, and the pharmacist work hand in hand in ensuring that the patient gets the best drug. Yes, so the physician is responsible for drug prescription. Now the pharmacist handles the dispensing of the drugs, the counseling of the patients, and follow-up of the patients to ensure proper use of their medications.
Interesting. I think that is worth knowing, because a lot of Nigerians actually mistake these things. That is worth knowing. Drug abuse has become a menace in our current society. True. Especially amongst the younger generation, who have this craze of they just want something that will give them pleasure. And that leads me to my second question, which is, Doctor, what exactly is drug abuse, and what are the causes of drug abuse? Okay.
Drug abuse is the illicit or harmful use of medications, or let me not only say medication, of substances generally, whether drugs or other substances. Yeah. So, and it's usually for to achieve for non-medical uses, you understand, and then to achieve a pleasurable or euphoric effect.
Wow.
Now, I would differentiate it from drug misuse. It's different from drug misuse. Drug misuse is the inappropriate use of medications. For instance, someone that is taking the incorrect dose of a drug, that's drug misuse. But drug abuse, the highlight of, or the main thing about drug abuse is they take these drugs to achieve a certain high, in quotes.
Wow.
Yeah, for non-medical purposes, and most of the time it is without prescription.
Wow. So people actually take drugs for euphoric reasons, so just make them feel good.
Yes.
Wow. That is actually crazy. That is crazy. For those who are actually taking drugs to maybe get pleasure, because I'm thinking, because whenever I hear the word pleasure, I think it's something that makes you feel good, that makes you have fun. Are there actually risks? Are there dangers involved in abuse of drugs? Okay.
I forgot to answer your question on the causes of drug abuse. Well, there are several causes. One of them is peer pressure. That's one of the major cause of drug abuse. Now, you also have curiosity. Wow. You just have they say curiosity kills the cat. They say so. That's another but the risks of drug abuse. Now, it cannot be overemphasized. There are so many diverse issues that come from drug abuse. Wow. One of them is the neuropsychiatric effect that this drug has. What I mean by that is I'm looking for the best terms to describe it. Neuropsychiatry just means the mental implications, leads to mental breakdown.
Wow.
Now these people they suffer from a whole lot of challenges. Depression. You see them separating themselves from people. Wow. They no longer want to be. You just see someone that is usually very active, social, friendly. All of a sudden he becomes detached, he becomes depressed. So the financial implication of that is even when you cannot afford these drugs, you just want to get on these drugs no matter the cost, so that is also there. Yeah, so there are a couple more. There are cancers. You have lung cancers from abuse of drugs. You have so many disease conditions that accompany drug abuse.
Wow. Interestingly, I'm not the only one hearing this. You can actually hear from the mouth of our speaker himself. Drug abuse ain't no child play. It's not something you want to play with. It's not something you want to play with. So, doctor, in addition, is it possible to achieve a drug abuse-free society? Like for people who already have themselves hooked to the usage of drugs, just like you mentioned, because the implications that comes with it is actually mind-blowing. Is it actually possible to have a drug abuse-free society, a society whereby the drug abuse usage is actually very low, and for people who have become hooked to the use of drugs, is there a way out for them?
Okay, so that is the first step. We need enlightenment. People need to, especially youths, because it starts from the youth level. If the youth can get it right in this matter, then it's go a long way to correct what we have in the society today. So that is it. If you want to deal with drug abuse, we need to send word out. We need to, as you said, have more programs. Yes, more enlightenment programs to enlighten people of the dangers involved in abusing drugs, as it were.
Doctor, I think if there is a wrong way to do something, there's actually a right way to do it. Would you tell me what is the right way to actually take or use prescribed drugs?
All right. When it comes to the right way to use prescribed drugs, I wouldn't say there's a universal right way to use prescribed drugs. When the patient just has to adhere to the pharmacist's advice on the use of those medications. When a drug is given to the patient, the patient is told how to use that drug, the time duration for those drugs. Then when you miss or skip a dose of your drug, you are told what to do in such a situation. Now when you notice certain changes, yes, as you are on those medications, you are told what to do, and you report back to the pharmacist or to the doctor who prescribed the medications for you. So well, that's about it. You adhere to the instructions. If you have any questions at the point of dispensing of the medications, you could always ask the pharmacist for what and what, just clarify whatever questions you have. Yes, so that's about it.
Interesting. I wouldn't say, if I say it has not been enlightening, I'm actually lying, because I'm not really too conversant with what goes on in the medical sector. But Dr. Onose has been able to do justice to a lot of this topic that keeps reoccurring. So, Doctor, lastly, I just want to ask, in the course of your life, do you have any health related story that you would like to share with us? Maybe how you overcame it, what it was, and how you got out of
it? In all honesty, I can't really remember any serious health challenge I've had. I thank God for good health.
Amazing.
Yeah, but well, I do remember this one situation when I was really sick. Wow. And I didn't go for a test, not start my medication on time. So I was really down. I was down. I came down that period, and I couldn't even help myself. I had to call for assistance, and someone came to get me.
Wow.
And I ran a test. I discovered I had typhoid, and medications were prescribed for me, and I started my medication. But aside, just don't really have a significant health challenge.
So as regards that now, like you are advising the our viewers that like it's important to, when they have like any symptom, it's important to quickly visit a hospital and know what exactly is wrong with them.
Yes, very well, very well. That is, in fact, that is one of the problems we have with drug misuse in Nigeria today. And once somebody is sick, oh, I have a headache, you take what you like. Oh, this, you just take what you like. It ought not to be so. So we also have antibiotic overuse today in Nigeria, where somebody has malaria, but he's taking an antibiotic.
Wow.
You understand? So those are the challenges we have, and definitely the way out is go for checkup. Go for checkup. Run a test. When you have any issues, you run a test.
Wow. I'm actually marveled. It has been much more than fascinating. It has been interesting, and it has been mind-blowing. Remember that health actually happiness, they say, starts with good health. Thank you very much, Doctor, for being with us on the show.
Thank you once again. It's my pleasure.
Thank you very much. So guys, it's been wonderful here. Thank you for taking your time. Thank you for staying tuned in till we see you next time. The show remains healthy, brought to you by ROROL Food and Farm Consult. Bye for now.